Welcome.
Hi there.
Hi.
Hi. Hello.
Hello. Amishkate.
Hi.
Hello.
Hello. I'm so excited to be here on the unceded shared traditional territory of the Squamish Nation and the Lillooet Nation. I have the pleasure of living here
on the unceded
shared traditional territory
of the Squamish Nation
and the Lillooet Nation.
Unceded. Now that's an important word. If you don't know what it means, make sure you look it up.
That word shared is pretty cool.
Shared traditional territory.
Territories of the
Squamish,
Lillooet,
Squamish,
and Lillooet nations.
I'm inspired. How can you not be?
It is a privilege to work,
live,
Play.
And learn here.
learned a lot actually.
It's a privilege.
We work,
we live,
Learn.
and play.
Especially the play part.
We honor their language, culture, and history.
I honor
their language,
culture,
And their history.
whatever you are doing right now.
whether I'm writing, whether I'm walking.
This meeting,
This event,
your online virtual huddle.
Your celebration, your time with family and friends is happening
On the unceded
shared traditional territory of the Squamish Nation
And Lillooet Nations.
This wonderful place we call home.
Thank you.
Thank you.
Thank you.
Thank you.
Boishka.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Wojtka.
thank you.
Thank you.
Isn't that awesome? It's the video runs better when you watch it yourself, and that'll be used a lot around our community to share where we are and the importance of what a land acknowledgement is all about. My name's Jack Crompton. I want to also say that was the world debut and sneak peek of the land acknowledgement video created by the SLCC team and some great community members. The SLCC will be publishing more information to inspire how anyone can take part in land acknowledgements. It's not just for meetings, and they'll be sharing that through social media. You can sign up for their newsletter, or you can become a member and keep an eye out for more information coming out in the next couple of weeks. I want to deeply thank the SLCC for allowing us to debut that tonight, and stay tuned for it and look for it around town. My name is Jack Crompton. I'm the mayor of Whistler, and I want to just thank everyone for joining us. Black Monday was this day, January 21st in 2008. Where stock markets crashed. The FTSE 100 had its biggest ever one-day fall in points. The European stocks closed at their worst results since 9/11, and Asian stocks dropped 15%. Now, those things are, important if you own stocks, but what happened after was devastating for families, for small businesses, for people living on the margins, for all of us. It was an enormous impact. I mention it only to say that we have been through extremely hard things before. and we will get through this. If I know anything about you, if I know anything about Whistler, I know that we're strong, that we're resilient, that we look out for each other, and I'm grateful for it. So as hard as this is right now, I just want to say that my confidence in you is extremely high. We have a lot to cover tonight and some amazingly dedicated local experts with a lot of important information to share. We're hosting this session because we've seen an increase in positive COVID-19 cases in Whistler. Such hardworking and engaged docs in our community raised this to us, and I thought it was a good next step to share this with you. It's important that we take action and take action now. I'm thankful that I get to introduce the people who have joined us today. It's amazing, I think, that this group of people have agreed to be with us. Dr. John Harding is our medical health officer for the Sea to Sky. He is here. He is actually not here. He's in Mccullough, he tells me, which is pretty amazing to have him working there and taking care of us here. Thank you to him for joining us. Our RMOW Council is with you. Dr. Olivia Bailey and Dr. Karen Kowski from the Whistler Medical Clinic are here. Lisa Mccullough, the Superintendent for School District 48 Sea to Sky, is here. Jackie Dickinson, Executive Director for the Whistler Community Services Society, is with us. Ginny Cullen, the CAO for the RMOW, is with us. Jeff Buckheister, the Chief Operating Officer of Whistler Blackcomb, is with us. Our local MP, Patrick Weiler, is here. Our MLA, Jordan Sturdy, is here. President and CEO of Tourism Whistler, Barrett Fisher, is here. President of the Whistler and CEO of the Whistler Chamber of Commerce, Melissa Pache, is here. It is an awesome group of people, and I couldn't be more grateful that you've all joined us. Thank you to that group of people for making yourselves available tonight. We will be taking questions that you can submit through the Q&A function at the bottom of Zoom. But first, we want to hear from some of the people who are here with us. And first to speak, to frame where we find ourselves in Whistler, is John Harding. We'll then hear from Lisa Mccullough about what's happening in our schools. Jackie Dickinson will speak to us about how Whistler Community Services Society is supporting community members and can maybe be helpful to you. And we'll hear from our doctors, Dr. Karen Kowski and Dr. Olivia Bailey, about their experiences and what they need us to know as a community. So without further ado, I want to welcome Dr. John Harding to the floor and turn it over to him. Welcome, John. Thank you for joining us. The floor is yours.
Thanks, Jack. Appreciate it. Hope everybody can hear me okay. Up here in Mccullough, so we're just running off LTE connection, so you have to forgive me for the low production value. And I really appreciate the chance to connect with everybody. It's been a challenge for everyone this past year. I'm looking forward to 2022 and taking a very long vacation. And what's important, I think, for everybody to know is that we do see transmission ongoing. The reason this is a pandemic is that we can't entirely stop the transmission of coronavirus, and so what we have to do is try to slow it down as best we can, at least until we can get everybody immunized as well too, and provide that protection to everyone. So that's what we're in the process of now. I'll explain my role a little bit. So I'm the medical health officer, one of the medical health officers at Vancouver Coastal Health, and my portfolio includes Sea to Sky, coastal rural. So it includes up here in Mccullough, Sunshine Coast, includes all the Sea to Sky for all of you guys out there. And our job in public health is basically to make sure that we track down all of those cases that result. We contact those cases, we let them know the results, we give them the information they need and help them to isolate. We follow them along until they're cleared and can return back into their normal daily activities. And the other important thing that we do is we reach out to all their contacts. So we really rely on those cases. We have these conversations with them where we do that contact tracing. We figure out who they've been in contact with and with whom they've spent time. And then we do a risk assessment. So for all the places they worked or were, we make sure that those folks receive the appropriate advice, because if they've possibly been exposed to that case, they may become cases themselves anywhere from 2 to 14 days after they've been exposed to a case. And so that's why, you probably are aware or know somebody or heard of someone who has been isolated. Cases, I will say, are typically isolated for 10 days because they're believed to be infectious up to that time. Most people are released from isolation after 10 days. It varies a little bit depending on how their symptoms go. Some people have a more severe course. And so for those folks, they may be a bit longer, but we do individual assessments on each and we follow them all along and we clear them before they go back to the community. For contacts, so people who have been in contact with a case and may have been exposed and then therefore may get sick, we ask those people to isolate for 14 days from their last contact with an infectious case. And the reason for that is because that's one incubation period. So that's the maximum amount of time between the time you would have been exposed to someone who has COVID until the time that you yourself would develop it. Typically the time is more 5 to 6 days for incubation, but it can be up to 14. So that's why we do that out of an abundance of caution. So, that's kind of that's the main meat of contact tracing. The way we receive all the cases is when the labs result, they're also sent to us. They go across our desk. And then I have a great team of people who are working a good 14 hours every day, just plowing through all these cases, making sure they get a hold of everybody, trying to do the best for the community. And we really appreciate everybody's cooperation. I'm sure there's a few people on this call who have been in contact with our team, and we really do appreciate it. We can't actually get this work done without the cooperation of the community and the understanding of the community. And so I really do want to say thank you to everybody that's participated. And thank you to everybody that's following the public health advice and that of Dr. Bonnie Henry as well, too, because that is what makes the difference. So I will say, I want to give everyone an update. We did see an increase of cases. Many of you have been aware back in November. So there were a number of cases back then. We're not seeing as many this time around quite yet. But that said, COVID tends to travel in certain social circles. And the important thing is that we do have really good COVID safety protocols in Whistler. And I can attest to that because with all the contact tracing, we're not seeing those transmission happen to the large part within our businesses and our restaurants. And so, that's thanks to the great COVID protocols that people have. By and large, the majority of the transmissions are still continuing to be social within households. And as you can imagine, since the transmissions are largely social, they do kind of travel within social groups as well, too. So we can see that reflected in the data. The majority of cases this year so far in 2021 reflects that of the proportions by age of 2020. We're seeing about 60 to 65% of the cases all happening within the 20 to 39-year-old age group. And it's pretty much an even split between male and female. That continues on this year. And then if you include the next group up to the age of, 2029, if you include the age up to 40, that's about 70 to 80% of our cases. And largely, I can tell you, a lot of these folks are people working in the service industry, a lot of people in staff housing. And I can tell you, since a lot of the transmissions are social and household, it has a lot to do with the function of these large households that we have in Whistler. So as many of you may be aware, a lot of the folks that we contact in staff housing can be living in households from anywhere to 8 to 13. I think our largest was 15 people. And it's really hard to isolate from other people in your household. So typically by the time we do find a case in a household, pretty much everybody else in the household has been exposed. And usually about 70% of those people in the household will then develop COVID. And so that's why you do see, when we do find some cases among these folks, we will send all these folks down, and poor Karen and the rest of her team down at the Whistler Health Center then have to deal with swabbing them all and giving them the advice and the care that they need. But we also have a lot of great folks in town, including Whistler Community Services, and Jackie's on the call today too, that we're able to try and provide people that support that helps them isolate. So we support them. A lot of these people who are working as lifties, they're economically vulnerable. COVID won't likely have very severe impacts on them from a disease standpoint, but it does have severe impacts from an economic standpoint. And so in kind, we have to make sure that we help support those people to work to be in isolation so that they can actually protect the rest of the community, because they're doing that not only for themselves, they're doing that to protect everybody else. And so we have to make sure they can do that safely and in a manner that that really helps us stop transmission in the community. I'm happy to stop there. That's our basic process. That's what we've been going through. And I can tell you, we're working as hard as we can. A lot of people didn't know public health was in the background until this pandemic came along. I can promise you, there are teams of wonderful people working as fast as they can on all of this. And I will tell you, our turnaround time on most of these cases is about 12 hours. It's usually always within 24 hours. So once we get a case, we are on the phone with them as fast as we can be. And we try to take care of these things as quickly as possible. We're very fortunate in BCH that the labs are on top of things. We really are the gold standard in terms of keeping up with the turnaround times, far better than a lot of our other jurisdictions and our neighbors to the south, who are really in tough times, as you can imagine. I'm very fortunate to work with the health team that we do have there, and Mayor Jack here as well too. I really think that you guys have done a phenomenal job in Whistler, and that proof is in the pudding in terms of we're going to see cases, but those transmissions are not as extensive as we would expect, thanks to those great COVID safety plans and what everybody's doing to keep Whistler safe. So thanks again, and I'll leave it there.
Thanks, Dr. Harding. I just want everyone to know that you can, there are now people Facebook live broadcasting this. So if you weren't able to get in, Paul Hothersall has a watch party on his Facebook page. If you can find Paul Hothersall, do. We'll have an opportunity to ask Dr. Harding and other people that have presented questions afterwards, but we will now move to our Superintendent for School District 48, Lisa Mccullough. Thank you, Ms. Mccullough, over to you.
Okay, good evening, everyone. I have a quick 5-minute update, so I'll have to move pretty quickly here. So I was asked, how are we doing? And we are doing remarkably well in the school district, thanks to the public health team and our staff, parents, and students. Before the winter break, we had 17 exposures. 2 were at Signal Hill in Pemberton, and 15 of those were in Squamish. And since returning from the winter break, we've had 6 exposures, 1 down at Don Ross Middle School, 2 at Whistler Secondary, and 3 at Spring Creek. We currently do not have any confirmed transmission within our schools. I'm going to take this opportunity to show everybody our website and where we keep our safety plan, because the next question comes in, so how are we doing this? And our schools remain extremely safe places for children to be. In fact, statistically, one could argue the safest place in a community for our children. And so what I want to do is quickly share the screen, and I will pop you into our school district website and hope that you can all see that. I'm just going to look for a thumbs up from Mayor Crompton. Can you see my screen? Awesome. So on our school district website, you'll find our safety plan for COVID exposure control. You can get just about everything you need there. Of course, you can always reach out and call me anytime. And I will remind everybody that all of our schools have their own safety plans on their website, so you can get your school-specific information. Our plan just has a whole bunch of introductory information. We have a risk assessment that largely is public health data. We haven't done our own. We've relied on public health for that. And then what you'll see very quickly is you come down to a drop down called the Infection Prevention and Exposure Measures for Communicable Diseases. This comes out of public health as well. And I bring it to your attention because this is an important hierarchy to understand the measures that we take in our schools in the priority order. So you can see on this diagram that the less effective measures start at the bottom with your personal protective equipment and your personal measures, and it moves up to the more effective measures that we can deploy in a controlled environment. So we start with public health measures. So you'll see that our plan is outlined under these 5 headings. So when you move down to our website, you'll see 5 drop downs there. Each will describe those sections for you. And I'll just quickly bring up each one so that you can have a quick view here. So under public health measures, you'll see a long list of the things that we're doing. This area contains things like our contract tracing measures, using learning group models, the supporting of testing when necessary through public health, the communications oversight and our protocols for that. And it includes things such as international education and students requiring testing 72 hours before they depart their country, and then a 14-day quarantine before they start in our schools. And of course, there is symptoms management in there as well. when we get down to the environmental measures, these become really, really important at our actual school sites. So this is where we will do things like have signage on the doors, floor markings, barriers, and we have physical distancing guidelines. Within learning groups, students are to reduce physical contact, but with outside of your learning group, when you cannot maintain physical distance, you maintain a 1 meter physical distance from anybody outside of your learning group. And we ask you to wear a mask when you're not able to consistently do that if you're an adult or a secondary student. It includes staggering our school openings and closings and breaks, restricting access to our school sites. So we only allow high priority adults into our building, and that often looks like our public health, community partners, and our food services. Many of our parent volunteers come in and provide very essential food security within our schools, and those adults are allowed in our schools. As well, you'll see athletic guidelines. So we do have school athletics, but they have very strict guidelines for how those can take place. There's community use guidelines, gathering restrictions, and then of course the normal cleaning and disinfecting protocols where we clean all high touch surface areas twice a day and also do our regular cleaning regimen in every school. It also includes information about ventilation and air exchange. And I know a lot of people in the community ask us questions about that. So you will find this type of information here, and it is a lot, underneath the environmental measures section. So I'll pop you down here to administrative measures. The next step in our process, in our plans, is to apply a number of administrative things, such as a transportation plan for school buses, staff training, so everyone understands how to follow these protocols and when we adjust them, how to do food services, so we follow stricter guidelines for the preparation of food and the sharing of food. This is where we actually establish the learning group cohorts and the schedule for those groups. And we also have really important scheduling and mental health strategies, including social emotional support each day through strategies in our classrooms, much of which is through an Indigenous way of knowing and learning in using Circle and through our local protocols gifted to us by our local nations. So there is a daily social emotional check-in, and there's a battery of mental health support. And I want to thank our community partners who I know are going to talk and share some of the things that we're relying on there. Now, the last two sections I won't drop down for you, but those are personal measures. So these are the personal responsibilities that we take when we're in our schools every day, monitoring our symptoms, staying home if we're sick, using respiratory etiquette, washing and sanitizing our hands, and just taking that personal responsibility. And then finally, we get down to the part where that all being in place, now we use our personal protective equipment when the guidelines suggest that. So as I mentioned, for adults and secondary students who cannot maintain that 1 or 2 meter physical distance, that's when they would be recommended to wear their masks. Our elementary students are not recommended to wear masks, and that's an important point of clarification, I think. So I think that pretty much does the lay of the land for our district level plan. Schools have their own underneath each of those sections. You can find them there. You always should contact your school principal directly if you have questions. They have all of the information you need. You're welcome to call me anytime. And I just want to say that the reason our schools are right now so successful in not having significant exposures and transmissions is the work of everybody working together and doing their part. So I want to thank everyone for that.
Thank you very much, Ms. Mccullough. We appreciate that. So our next presentation is from Jackie Dickinson from Whistler Community Services. I will unmute myself 1 minute before the end of your 5. Over to you, Ms. Dickinson.
Thanks for having me. As has been mentioned, I'm very proud to be the Executive Director of Whistler Community Services Society. We've been fortunate to always be a helping hand in the community, and this time is no different. This is our opportunity to continue to do the really good, important work, and we feel lucky to be a part of it. That helping hand now is sanitized, always was, but even more, maybe 6 feet apart, wearing masks and plexiglass, but the compassion and care we have for the people and at this community has not changed. So if there's anything else I could say, that's the big piece that I would like you to know. This care has always been collaborative, and this time now is no exception. We are collaborating with Dr. Karen Kowski, Olivia Bailey, and her team on a regular basis. We know there's power in collaborative continuity of care, and as John Harding said, we're working with public health to ensure that we're all at the same tables in an effort to confidentially support the people in this community. I know Dr. Karen Kowski will go in a bit more detail, but when people arrive and to get their tests, the information for their test results also has our contact details. So if you are an individual accessing a test at the Whistler testing site, you'll get to your phone this piece of information around your test results, but also how you can reach out to us, how you can book an appointment with us, how you can arrange a food bank delivery. And so we're trying to create those synergies so there's less work on your end and it's easier for you to make the connections. We've always said this, and this is the time to say it, that reaching out is a sign of strength in our community. As we continue to do it, our community will be stronger for it. So please reach out. And that's one tool and device we're finding ways to demonstrate that collaboration and make it easier for people to connect to the care. The other piece is that we have a few services that we've always had, but we also have a few services that have been in response to this pandemic. One is specifically our food bank delivery system. So we have a food bank service that's open to anyone who is experiencing food insecurity. Our drop-in hours still remain in person for those who can safely do so and are not exhibiting COVID-19 symptoms, experiencing an exposure or waiting for test results. That's Wednesdays and Fridays at our location, 1:30 to 5. I want to say hi and thank you to everyone at WCSS who's on this call, making that happen in our food security teams. But if you are isolating and you are in need of food, we have a food bank delivery system by calling our main office line. So I'm going to encourage you to visit our webpage at mywcss.org. There you can actually get all the information you need, but the main thing is you're going to call our main office line to access a food bank delivery. Grace Block and Jen Hashimoto, 6 days a week, are answering our phone lines to help you and navigate a way to get food to you. Our goal is to get you to stay put, stay safe, and stay put. And so that food bank delivery system should provide enough food for you over a 3 to 5 day period. And our team can also return to top up that food. We support accommodations for food restrictions and allergies. So please vocalize and tell us how we can best support you. And with that, we've also responded in partnership with the Whistler Blackcomb Foundation. Thank you, May Madden. Thank you, Whistler Blackcomb. Thank you to your foundation and board for supporting us. We developed hygiene kits that are now being delivered to individuals' homes. As Dr. John Harding said, we're talking about economically vulnerable people and high density housing scenarios. So with those food bank deliveries, each individual person in that house gets a hygiene kit with all the tools and essentials they need to safely isolate in a high density housing scenario. Thank you to Dr. Karen Kowski. She suggested that we add information from the BC Centre for Disease Control on how to safely isolate. So all that additional information comes in that kit your way should you and your household needs it. We are open again at 9 a.m. Looking forward to your calls. As people have suggested, and we know there's increased cases in our community, which means we're getting more calls. And so we hope to deliver food within a 24 to 48 hour period. I will say, people are so grateful that we arrive, but please stay indoors. This is a contactless pickup, and so please continue to do your part. Thank you for the support and the waves and the acknowledgements, but please stay inside to support that contactless porch pickup. My final thing that I want to share is that our outreach team for the last 15 plus years of amazing people has always been here to provide mental health and emotional support to our community. And now is the time for us to continue to do that work. You can book online for a virtual appointment if you are isolating, housebound, and all those appointments can be booked at your convenience on our website. You can also arrive in person, again, with all of our safety protocols in place, putting safety at the forefront so you and our team members can connect in the best ways that we know how. And keeping in mind that we can also provide financial assistance through our food security programming or through our counseling assistance program. We know throughout this pandemic, isolation and all these things impact our sense of belonging and our mental well-being. And so our services are here to connect you to higher levels of care for mental and emotional support, clinical counseling that you couldn't normally access due to financial restrictions. I also, at this time, in the last couple minutes, I want to thank everyone on this call. I want to thank the community for your support. Last spring, we experienced a closure of our stores, which meant our massive revenue stream of the reuse it and rebuild it shut down. And we were able to keep going as a result of the donations of this community, which is why we're on this call, why we're continuing to do the work. So thank you for having us at this table, Jack. And thank you to everyone who's part of this call. Those were the big overall resources that we wanted to highlight and to continue to say, we're here.
Thank you very much. Appreciate it. And our final presentation before we go into questions for anyone that you see smiling face on this screen are Doctors Karen Kowski and Olivia Bailey. Thank you to both of you for your very good work and for raising this to our collective attention. I'll turn it over to Dr. Kowski and Dr. Bailey. Go ahead.
Thanks. Maybe I'll start and then I'll hand it off to Olivia. So I'm Karen Kowski, and Olivia Bailey is one of my colleagues at the Whistler Medical Clinic. And we took on the operations of the COVID testing and assessment early in March with no idea of what it would turn into or how long it would last. But it has been really amazing. I read in the question and answer, somebody asked about why it is an appointment-based system, which it is. And that's because in a small community, human resources are a problem. And we have not as many GPs as we need. So everybody that is running this COVID center also runs our office, runs a virtual walk-in clinic that we started to try to provide virtual access to care for people that are unattached, as well as the COVID. And the demand is really variable. We can go from doing 20 assessments or seeing 20 people a day to 100 the last few days. So that's hard to plan for. And the appointment-based allows us to spread that out over the day, make sure that we have people doing the job. And it allows us to connect with everybody. As Jackie said, we do text people to come up to the trailer because we don't want a lineup of 100 people. And that text does say, do you need help with food? Do you need help with housing? Do you need financial help? And so that's on everybody's phone and you can access those resources, and it has been really appreciated. One of the things that we noticed really early on that has already been mentioned is that the COVID pandemic has in our community disproportionately affected a really specific demographic, which are young people that work in the service industry or as frontline and live in dense, large housing situations. And that makes this really difficult. What I'd like to say in the spirit of Bonnie Henry's be kind, compassionate, is it has been so striking to me how committed this demographic is to doing the right thing. And I don't think everybody knows that. And it is difficult to do the right thing in these situations. And if you are economically vulnerable, and they're not doing it for themselves. John Harding pointed out, largely everybody that's doing this is doing it for the rest of the community. So to me, that has been incredibly inspiring throughout all of this. And I'm just really proud to be a part of such an awesome community. Olivia, I'll hand it off to you. Olivia, you're on mute.
Sorry. Thank you, Karen. That was an amazing start. I don't have a huge amount that I need to add on top of what Karen said. I guess, as everybody knows, we are seeing more cases this week. And I guess that's what made us get in touch with Jack, wanting to not just like put the information out there, but do it in a way that was more connected and holistic. So thanks so much, Jack, for putting this together. I guess, yeah, a few little things I wanted to add on there were that to let everybody know that COVID care is free, regardless of your immigration status. You can access the care. It is not just a turn up, drive through, test and go. We are trying to provide a really holistic service. So, if someone's asthma is exacerbated or they've got another problem, we are dealing with that at the same time. So hopefully that's preventing us getting to a situation where people come in for their test, but are sick with something more serious a few days later. So we're trying to do, and also add in that like social economic aspect, making sure that everyone's aware of the care that they can access through Whistler Community Services. I guess another thing I'd love to mention is that early detection is so important. So if people are noticing that they have some symptoms, not to like hope that they might go away and push on through, but just stay home, give us a call, get your test done. The whole process is pretty quick. We try to see everybody within a 24-hour period. I don't know that there's been any cases where it's gone beyond that. It's pretty much always same day that you'll be seen, or otherwise early the next morning. And the test results are coming in really quickly. BCH is doing an amazing job there. It's 24 to 48 hours at the moment to get the test results. So it just pauses your life briefly, but that can make a big difference if you are developing symptoms of COVID. And I guess, yeah, recognizing that we are seeing more cases around now than I believe we've seen at other times, although John might correct me on that. That maybe now is a time to kind of go back to following the advice kind of to the letter, as perhaps we did in November to get it under control. Last time it got a little bit more intense, and just making those small social sacrifices that mean a lot. The majority of transmission is either obviously within households, but within close contacts, within small social bubbles, small social gatherings. It does make a big difference. So if we can just all pull back on that and go back to trying to follow the public health advice, I think that's all it takes to get this back under control.
Olivia, I was just going to amplify one of Olivia's messages that really resonated with me and I think is important. Everybody I speak to says, I'm sure this isn't COVID, and then they tell me their symptoms. And clearly a pretty good percentage of those people are wrong right now. So everybody thinks it's not COVID. And I think that message that Olivia stated should be highlighted. If you're the least bit worried, please call us.
Mm-hmm. Yeah, the conversation that I've been having with a lot of people online is about visitors. And one of the things that's really occurred to me today, I don't know who said it to me and I haven't been able to find where they said it, but this is an everybody problem. This is a traveler problem. This is a problem for people who've lived here for 50 years and those that have lived here for 5 months. And it takes all of us to respond. And I think that point that this is transmitted between people who are closest to each other and know each other best is an incredibly important reminder to us. You will transmit it to your best friend when you stop to have beer at their house 1 million times Crompton, don't talk numbers and pretend you're an expert, but I will say this, you will pass it to the friend that you have a beer with far easier than you will walking by someone on a trail outside or skiing. And so it's a reminder to our community that we need to respond. We've got a million questions, and so why don't we just get into them? The one that has risen to the top amongst them all is, how many cases are there in Whistler? So I will respond to what I know and then maybe turn it over to Dr. Harding to correct me. So 2 weeks ago, we had 14 new cases of COVID-19 in the Howe Sound health area, which extends from Squamish, Whistler, Pemberton, Mount Currie. In the last week, the 10th to the 16th, we had 63 in that same area. So that's a large expansion of new cases. And my expectation, and I don't know any other numbers, is that that number will go up and that we need to do everything in our power to get a handle on it. Dr. Harding, are you there, or has Mccullough dropped us from you?
I'm still here, but I've abandoned video just in case, so I can continue listening to your soothing voice, Jack.
That's probably a great practice. Go ahead. Numbers, was I correct? Correct me where I'm wrong.
Yeah, I mean, those numbers that the BC CDC is posting. And yes, we did see that increase. You know, when you do see a number of cases like this, the question is, you know, how many cases are going to come out of the tree when you shake it, which is what we do in contact tracing. Often what happens is, you know, what's happening right now is that there's increased awareness. People tighten up any practices that they weren't doing quite as well before, and we make sure that we reach all those folks that may have been exposed. And so, you know, when you do find a case in a household, you expect more to come out. The question is, you know, how deep does the rabbit hole go, and how many more cases will we see? I really can't say. Usually what happens with clusters like this is we'll find a number of cases, they get to a certain point and then level off, and we'll consider we typically would see cases trickling out, you know, one or two, you know, every other day for a while, and it should slow down. I don't know if we're quite at that point yet where we found all those cases. So that's why we just have to keep doing the good work that we're doing, sending all these folks down who are symptomatic to get them tested at the local center, and we just keep connecting with those contacts of any new cases. So, you know, I'm hopeful that, you know, this won't go any further than what happened in November. I think everybody did a great job then. I'm sure some people were enjoying themselves a bit more over Christmas and New Year's, as we all do. There's a lot of pressure from aunties and uncles. I know a lot of people had to succumb to some of that, and that does lead to a bit of transmission. But the important thing is that we're doing the right thing now, which is following all that Bonnie Henry advice. And please pay attention to public health if we do give you a call. And please, if you do have any symptoms that are consistent with COVID, try not to brush it off. As Karen was mentioning earlier, just go and get it checked out. It's better safe than sorry. I can tell you for this year, so far in total for 2021, we've had 103 cases in Whistler. Compared to all of 2020, we had 271 cases in Whistler. The proportions are about the same, but in total, we've had less than 400 cases in Whistler since this whole pandemic started. So that's the state of the nation right now.
And a question here from Lester is, what is the current positivity rate? Is that something that you know and share?
Yeah, that's always a good question. People do focus on positivity rates. It depends on the denominator that you're going with in terms of, you know, the total population, or if you're thinking about the total number of tests that are being done. You know, the positivity rate would be 0 if nobody was going for testing. You know, that's why we do see the positivity rate go up. I don't have the numbers right in front of me, but it does go up, and you do expect that when you do find some cases, and then you do contact tracing. If we didn't do contact tracing, we wouldn't find the other cases that are connected to them. So I try not to focus too much on positivity rates, because you know, these things vary and they're very dependent on those factors that I just mentioned. You know, we don't typically base a lot of our decisions on it. So I think the important thing is just making sure that we're reaching all those people that are symptomatic, and then trying to get them isolate all the advice that we were mentioning earlier.
Great. Another one for you, or maybe for Dr. Kowski and Dr. Bailey. The question is from Kevin Wallace, and it says, if a person who has already had COVID-19 and recovered and is now again exposed in a close contact with a positive case, do they need to isolate again, or will the doctor advise that they are immune?
It's John. I'm happy to take that one. I mean, we get this question a lot. We're at a point where some people have already had COVID, and if it's lab confirmed COVID and they definitely have had the disease, they're going to have some level of immunity. The problem is we don't know how long that immunity lasts yet from getting that natural infection with COVID. The general standard at this point in terms of contact tracing is, as long as that infection was within the last 3 months, it's very likely that person still has immunity to COVID. So it's not likely that they're going to catch it again at that point. There are a lot of studies out there that talk about people getting reinfected. That happens very rarely. And in the cases where they do get reinfected, it doesn't appear that they're infectious. So just as the same as some people would have been had chickenpox as a kid, if you get exposed to chickenpox again now, you kind of get a mini infection, but your immune system is so good, it gets rid of it so fast that you're no longer infectious to other people right away. And that's pretty much the same story with COVID. Time will tell. We'll eventually have the evidence to say how long you're immune, either from getting COVID itself or from getting the vaccine. But those are all things that people smarter than me are currently working on. So we will know that in future. But right now, the standard practice is within the last 3 months, if you've been positive, we're not worried about you getting positive again.
We will come back to you because there's a lot of questions here for you. But the question from Jamie Deneen, I think, is best for Jeff Buckheister. There has been a provincial advice to not travel for non-essentials. I want to ask why Ski School is running programs on the winter with residents from Vancouver.
Yeah, look, I think like everyone, we're doing everything that we can to do the best job that we can to deliver the products that we offer and into the mountains. And so, yeah, I think we have that available because I think if someone's here to ski, they will choose to ski, whether we're offering ski school or not. And I think in our position is that we've put a lot of thought into how we can do a very low ratio program for a student and get them exposed to the mountains in the way that provides them a safe environment, both generally as it relates to skiing and snowboarding, but also as it relates to COVID and exposure and all of those things. So I think the broader part of that question is we've had to pull back on a lot of our programming, and that's just a function of we had to bite off what we felt like we could deliver, and certainly found some areas where we felt like it was best to not do those programs because our ability to deliver would diminish the more that we took on. So that's a bit of the reasoning for certainly the younger kids that we have out there.
And who determines whether you stay open and what your safety protocols are? Who are you working with on that kind of a project?
Yeah, well, I'd say the term I would use is partnership with this community, and it's several people on this call that we've partnered with since back in March, and had almost daily conversations. But also, I'd say the partnership with VCH and our building of our protocol, our building of our business plan from summer to from summer into winter as we shifted seasons and the operation got more complex. They've been a partner all the way through, and also have been on site several times in the last several weeks. Not in any other way, but looking at the operation, continuing to give us guidance. We have a great relationship with James from VCH, who's our go-to for almost everything. And yeah, I mean, sometimes it's like, hey, let's make an adjustment here with that plexiglass barrier could be a little bit higher. Sometimes it's the tables have gotten a little close. But by and large, the feedback has been the two things that we all hear all the time. mask up. And the rule of thumb I use is mask up all the time, because you might as well just do it and not have to do it up and down and decide when it's appropriate to have it and when it's not. And the other one is spacing. And we've looked out, I point out here to where we have lineups a lot on our busier days. And yeah, James looked at me and said, hey, I don't mind how long your lines get. What I care about is what you're doing, which is working the line, making sure that people are taking care of each other by spacing out and by wearing their face covering. And as long as we do that, the length of the line is somewhat inconsequential to what we're doing. And certainly given the upload capacity and the reductions that we've done there with all of our gondolas, the lines just get longer. They're longer because they're spaced out, and they're longer because our upload capacity is a little bit, are greatly diminished due to COVID.
Thanks, Jeff.
Thank you.
Our next question, I think, is probably best dealt with by our two other politicians from other levels of government, orders of government, sorry, Jordan Sturdy and Patrick Weiler. And the question is from Steve Donahoe. When the provincial government and airport authority put restrictions in place for those who fly here for when will the provincial government and airport authority put restrictions in place for those who fly here for vacations? I'll turn that over to Jordan Sturdy.
Thanks, Jack. Well, coming into British Columbia, whether you're flying or if it's interprovincial travel, if you're coming into British Columbia from other provinces, I think you've all heard the government was getting a legal opinion on whether or not there was an ability to restrict travel. And coincidentally, they just put out a release a few minutes ago that suggested that their review of legal opinion made it clear we can't prevent people from traveling to British Columbia. We can impose restrictions on people traveling for non-essential purposes if they're causing harm to the health and safety of British Columbians. Much of the current interprovincial travel is work-related, etc. Public health officials tell us that the most important is everyone obey the health orders. And now I think fundamentally they can also put tighter restrictions on all of us as opposed to just particular travelers. Although entering in from another country is another issue, and that's probably best for Patrick to talk to.
Thank you very much, Patrick.
Yeah, well, right now we're not having people vacationing to Canada from other countries. We have rolling border closures with the United States, which have been extended again for another month until February 21st, and likely will be extended after that as well. And likewise, we have similar restrictions coming from other countries, or from all countries around the world, with only a very, very small exceptions in a very, very select amount of cases, but it's not for vacations at all. And even Canadians returning home from abroad right now, Canadians have a right that's protected under the Charter Section 6 that they're always allowed to return home. But with that said, we have brought in some new measures that requires you to have a test that within 72 hours of flying back home that shows that you don't have the coronavirus. So those are very much in place, and upon return, there is a requirement for mandatory 14-day quarantine periods. And that's where we're at today.
Thanks, Patrick. This question is from Casey. It's for Lisa Mccullough to answer. Why are we not asking elementary students to wear masks?
Okay, well, I'll do my best, but I'm sure the doctors could do a much better job than me, because this isn't a school district strategy. This is, in fact, one of the public health recommendations. And what we understand is, first of all, our elementary age children are not transmitting the virus in the same way as adults are doing so. But also, when we have young ones putting masks on their face, they often need assistance with that, which requires another adult to get in close proximity, probably closer than they should be. But as well, we find that our children are playing with their masks more often and fidgeting, which means they're exposing their hands to their face more frequently, making it more likely that they're going to pick something up on their hands and touch their face. So let me be clear, I'm not the expert on this topic. This is what I have been taught, and that is what has been explained to us as one of the measures we use.
Dr. Harding, do you want to add anything to that, or is that sufficient? Dr. Kowski, Dr. Bailey, anything?
Yeah, I think Lisa's right on about that. I think public health, I don't want to speak for public health, but they say they don't see transmission in schools. They see the transmission when kids do get it, usually at homes, and it is really difficult for young kids to wear masks.
Great, thank you. Maybe this one's also for MLA Sturdy, which is road closures. Can you comment on why the highway hasn't been closed to restrict traffic access into and out of Whistler?
Well, it's I don't believe that it's a particularly practical solution. There's so much travel back and forth for everything from work. Fundamentally, though, we're supposed to be traveling for essential travel. And that's the recommendation of the health authority. That's what we should be adhering to. I suppose there could be a roadblock and everybody's address checked and then queried as to whether or not the trip is legitimate or not. But I don't think that's an initiative that at this time government is seriously considering.
Okay, I have another question here for Dr. Actually, hold on. Dr. Kowski, can you talk to us about your expectations of, and obviously you don't know the future, but what are you expecting as far as the rollout of the vaccine in our community and what that will look like? And if you don't have an answer for us, that's fine, but I think maybe just some of your thoughts around how that will happen. That's a question from Graham McFederich.
Sure, and I'll ask John Harding to just jump in if I'm getting it wrong, but as I understand it, we don't know exactly what that's going to look like for the general public yet. And we expect to have sort of those volumes of vaccines in a couple of months. And the initial plan was to start with everybody in the community over the age of 80, and then work backwards, I think, in 5-year increments. And there's John to save me from making a mistake.
No, you got to bang on, Karen. That's exactly what the plan is. There was a rough timeline associated with that as well too. But the issue is, and a lot of people would have seen in the media recently, that the supply chain varies a bit. So we can only give vaccine as fast as we get it, and I can assure you that's certainly what we're doing. And then prioritizing, where the biggest issues are. So the biggest impact is really in long-term care facilities, which has been nearly 80% of the deaths in BC are in long-term care facilities. So that has been our number one priority, to protect those residents. Many of you may be aware, we do have an outbreak in a long-term care facility in Sea to Sky. That's down at Hilltop House in Squamish. And so we've been working really hard to make sure we protect all those lovely grandmas and grandpas in there, and also immunizing the workers who work in those homes. And so that's what our focus has been, along with acute care, emerge, all the other essential services and those people that are working in these kind of uncontrolled settings and high-risk areas. And then, as Karen said, the plan is to roll out to the community and do it in order of age, because the older you are, the higher your risk is from COVID, and it will go down in 5-year increments. But it really is dependent on how soon and how much vaccine we get.
I'm to remind everyone to please use the Q&A feature, though there is more questions than we'll be able to deal with tonight. But if you have a question, please insert into the Q&A, and we will try and get answers to all the questions and share it with the public. One question for Dr. Harding: why aren't we breaking out numbers in a more granular level, so that we have Whistler cases, Squamish cases, Pemberton cases?
That's always a really good question, and it's been asked since day one. The short answer is that a lot of these are very small communities, and we didn't have a lot of transmission early on, and we are still fortunate the transmission is fairly limited now in our communities as opposed to the lower mainland. So you can imagine if I give a number for the number of cases that happened in North Vancouver versus the number of cases that happened in Pemberton, they can be considered identifying, especially if you only have one case. And in a small town, everybody knows everybody. So there's the concern around that. Secondly, it's a lot of work to stay on top of these numbers, and we do the best we can, but it requires a lot of what we call data cleaning to make sure that we get those numbers right all the time. And I can tell you it causes a lot of work when numbers don't line up and we have to spend a lot of time coming back and looking at the same numbers. This is the same small public health teams that are working on the rollout of the vaccine, working on inventory, working on making sure that we report all of these numbers up to the BC CDC. And so, there's a provincial agreement that numbers are rolled out at that HSDA level. And those are the ones you were referring to earlier, Jack. And so, that was a provincial agreement, and, certainly more granular data is available, but we try to reserve those efforts for when there is a situation where we have a spike in cases like we currently have the New Hawk Nation up here in Mccullough, where they've had quite a number of cases. And so that's where we would take our epidemiologists and make sure that we're counting every single case and paying very close attention to the activity because we really want to put our efforts there. And so doing that, for the wider community, for all of UCH all the time, has a lot less utility and takes up a lot of people's time who really are working as hard as they can to make sure that we slow down the transmission and get that vaccine out there as soon as we possibly can.
Thank you. I think this one's probably best for Melissa Pache, the CEO of the Whistler Chamber. It says, being that most cases are happening in staff housing. Oh, no, that was not the one I was going to ask. Well, yes, I will ask that one to you. Being that most cases are happening in staff housing, are we working with business to establish protocols on sharing accommodation to limit the spread of the virus, especially since most hotels are running at 40% below occupancy currently? I guess that's one that you can share with John probably, and maybe.
Yeah, I mean, even I know Saad's on the line. He's asked some questions as well, and working with the general managers at the hotels, they have been so vital in the way that they've approached their safety protocols. So in terms of staff housing, that's one part, but working independently with each of the businesses, they've received quite a bit of information through the chamber. They can also receive it through WorkSafe BC as well, but more information is better as well, always.
I agree. Any comment, John, on isolation housing and supports that way?
Yeah, it's a good question. Housing is always a hot topic in Whistler, guys. And we did arrange back in December with Whistler Community Services and BC Housing and RMOW to make sure that we had additional housing available. And so that's for people who become positive or in these households and don't have a safe place to be housed otherwise. Other than that, we have to deal with the situation we have. Whistler housing wasn't exactly built for a pandemic. You do have people on high density. It makes it hard to stop. And by the time you do find a case in those houses, it's too late. The other people have been exposed. So the best thing to do for most of them is just try to stay put. And that's why we want to support them to do so. It would take us a while to rebuild all that housing. So, unless we can find new places to put people, it's going to make it very hard, to basically make sure we bring down the density of those houses. So in the meantime, this is the best approach we can do, and I think we need to look forward probably to future plans as to how we might be better able to manage situations like this with the infrastructure we do have.
I just want to add too is the conversations I've had with businesses that have staff accommodation. They've been exceptional at rolling out the communication that's needed around COVID safety. But as John said, it's sometimes at that point impossible to kind of control that environment internally. But I know the businesses are very serious about it. It affects their business. They have to shut down if the protocols aren't in place. So rest assured that businesses are doing what they need to be doing right now.
Also from the WB perspective, where we have a lot of staff housing, we intentionally held back units from our inventory at the beginning in anticipation that we might need to isolate folks. And so we have a number of isolation units and available that we're using and as needed, and found that to be particularly helpful as we've managed through it as well.
Mm-hmm. Thanks, Jeff. One thing that jumped into my head is yesterday, President Biden was inaugurated, and he asked everybody to wear masks in the US for 100 straight days. Maybe we could join them in that effort. More questions here. How well are mandatory quarantine? So I guess this one is for Dr. Harding as well. How well are mandatory quarantines supervised? How often are officials checking up to make sure the positive case is following guidelines? Friend of mine said someone on the Blackcomb gondola with a stranger said stranger got a phone call asking how's his quarantine going. So obviously the stranger wasn't listening to the protocol with the rules of quarantine. That's from Keegan Palmer.
Thanks, Jack. Yeah, I think two things to clarify. So mandatory quarantine is usually referring to people returning from overseas, and that's a federal issue where people should be staying in their homes for 14 days after returning from overseas or traveling from elsewhere overseas. In terms of self-isolation, which is what public health asks positive cases to do, that's usually a 10-day period. So it's as long as they're infectious. And there's only so much that we can do in public health. I can only be so many places at once. So we do rely on the public to follow our directions. If it's clear that people are not following directions and are possibly exposing the public and others, I'm allowed under the Public Health Act to disclose that information either to businesses or to other authorities to make sure that we protect the public from that risk. So I have done that, and I will continue to do that as necessary. That said, we're only as good as the information we get. So if people are up on the gondola answering that phone call, trying to pretend that they're actually in self-isolation, it's challenging for us to always know that. So we do rely on the community overall to do the right thing. What I will say is that this is also a population health intervention, which is different than the individual level. So I don't need every single person out there to follow our guidelines to a T. I appreciate some people can't for particular reasons, whether they be economic, whether they have a loved one that they need to care for, whether there's a funeral. Sometimes people have to make decisions that are very hard, trying to choose between what's best for the community and what they may need to do for themselves. And so it's okay if that happens, as long as the vast majority of people are following the guidelines. The majority of the time, we will slow down and stop the spread of COVID. And I really, I can't emphasize that enough, that, there are always competing interests, and we really do our best. And we do follow cases along right up until the day that we consider them no longer infectious, and then we clear them to return to their regular daily activities.
So this is from the youth center. Well, actually, I think we've already answered that question. It's about masks for the high school, but I'll just repeat what we heard earlier. Actually, Dr. Harding, do you have a comment on masking in schools as to why we're not requiring masking in schools? We heard an answer earlier from Lisa Mccullough and joined by Karen, Dr. Kowski, and Dr. Bailey, but just thought maybe you want to comment on that.
Yeah, absolutely. Masking is also a big flashpoint for people. And just putting on a mask doesn't mean that we can forget about all the other steps that we should do to prevent the spread of COVID. A cloth mask doesn't negate the need for distancing. And as was shown by Lisa earlier, there is like a hierarchy of controls. So there's a number of things we need to do, and it's kind of a Swiss cheese model. None of them are perfect in isolation, but if we line them all up, there's less chance that transmission can happen. Masking is only one of those things. I can tell you the transmission dynamics among older kids, so high school kids, is much more similar to adults. And so that's why we prefer that high school kids are wearing those masks, because it is that extra layer of protection. And then the younger kids are, the less likely they are, first of all, to comply with mask wearing, but secondly, they're also not as good at transmitting COVID or giving COVID or getting COVID. So, it's really important to know when we look at our numbers, if you're under 10 years old, you're really bad at getting COVID, which is a good thing. So it lines up pretty well in that, the people that are least capable to wear masks are the ones that are least likely to get and give COVID to others. And even if they do get it, kids are the least impacted from a clinical perspective. As long as we keep these numbers low, we've been doing really well. So again, the older your age, there's one of many downsides to getting older, but the older you are, the higher the chances are that the impacts of COVID will be more severe. And it's reflected in the data that we continue to follow along in schools. And again, to Lisa and her team and all the kids out there, I think they've been doing a fantastic job. We do see those cases, but dollars to donuts, I can tell you, a lot of those transmissions are just happening in the household and not with those kids doing the best they can on the school grounds following those protocols.
Thank you for that. Question for Barrett, CEO of Tourism Whistler. Can you talk about the stats behind visitors to Whistler in the holiday season, and what do you expect for Family Day and March break?
Sure. Well, when the order went in, I think we were as far as back in November for non-essential travel. I think hotel occupancy dropped to about 10%. For the month of December, it got up to 27%. But keep in mind that that would be based on a number of reservations that would have been made months and months in advance of that. I think the majority of that 27%, more than 90%, would be from our regional markets. So our out-of-town guests were at a minimum. However, when we hit January, that dropped right off, especially after the stay-at-home order was put in place, noting that it was a non-essential travel recommendation. And so while we were advising all of our guests of that information, it's on our website, we actually did halt all of our marketing efforts. I did notice a comment on the chat that said, why are we still advertising? We're actually not. There is some forward advertising looking to the spring, summer, but there's been nothing to promote December, January, or February. And then looking forward, the bad news for the business community is it's looking dismal. The good news for the local community is that it's looking dismal. We're anticipating that visitation will likely, if it's going to come, it's still coming from local Pemberton, Squamish, regional Vancouver. But because that market books very, very last minute, at this point in time, our forecasts are very, very low.
Thanks, Barrett. We are about to lose our docs, so I want to ask them a question. And this is like a slow pitch down the middle that Karen is going to hit out of the park, because this is something we've been talking about a lot before COVID. So the question is from an anonymous attendee, and they say, pre-COVID, it was already hard, impossible to get a family doctor in Whistler. With COVID, it feels like going to the doctor is adding to a pressured system. Should we be worried about seeking out care on other issues? And is there still bandwidth for more routine care? And then from me, can you talk about the challenge, please, around primary care physicians and access to people like yourself?
I would be happy to talk about that because it's a passion of mine. In Whistler, we do have a shortage of family doctors, and that's doctors doing longitudinal relationship-based care. We actually have a really robust acute care group of physicians. So the shortage is in GPs, and that has a lot of reasons for it. Some is just the complexity of running those practices has really mushroomed in the last few years. And then the economics of being in Whistler. Although it isn't unique to Whistler, it is across BC, and we are actively looking at it. The reason that Olivia and I are leaving at 7 is because we have a primary care task force in Whistler, and we're meeting tonight to look at piloting a project to try to increase the number of providers practicing in this model. So yes, we're busy. We're running the COVID testing center and assessment, and we have a virtual walk-in clinic. But it is absolutely appropriate to access primary care and to look after everything else. In other acute crises or pandemics, and again, John Harding can maybe correct me, but generally more people have morbidity or die of things other than the pandemic or the acute crisis because so many things get overlooked. So it's really, really, really important to access care and to deal with things.
Thank you. Yes, get care, get care, get care, get care. That was one of the conversations that sort of bubbled to the top when we were discussing this yesterday from Dr. Bailey and Dr. Kowski, is that please don't push off seeing a doctor because you think you're helping someone else access care. Get in front of a doctor if you feel you have a problem. Dr. Harding, there's a question from Steve Donahoe. He said, did I just hear Dr. Harding say that if someone feels they can't quarantine, that's okay? I didn't hear that, but I just want to make sure if you want to just clarify what you were saying about quarantining.
Sure, happy to do that, Jack. So what I am saying is that the majority of people are doing what we're asking them to do, and I think that's fantastic. But I'm not under any illusion that there is a certain proportion of the population out there who are trying to evade what we're asking them to do for whatever reasons. And I'm not going to judge whether those reasons are valid or not, whether it be they're taking care of a loved one, whether they do have a lot of financial economic constraints, as I do see with a lot of our cases up here in Mccullough, and they're living paycheck to paycheck. No, it's not okay from a community perspective for people to not follow our instructions, because that's not going to help us stop COVID. But again, this is a population level intervention. So the important thing is that the majority of those people are doing what we're asking them to do, and that we're trying to help those people who are not doing what we need them to do. And for those people who are intentionally exposing others, if I become aware of those people and I get information from many sources, I'm happy to act on that information. I haven't hesitated to call the local police, and I've done it before in Whistler when I've had people very abusive to our staff when we're asking them to do what they need to do. And I can tell you some of that resistance is because of the economic restrictions on those people and what Jackie spoke to earlier. So no, what I'm trying to make very clear is that I understand not 100% of the people are going to do what we need them to do 100% of the time, but we try to get as close as we can to that any way possible. And I really appreciate, the community's understanding and support and participation and making sure that we try to keep everybody else as safe as we can and support the ones who are required to isolate and for whom it is a challenge.
This will be the last question for Dr. Harding. Can you talk about the new variants and what we know about them and what we should do in response to new variants being around us or not?
Yeah, there's a lot of excitement around the new variants, South African, UK. The BC CDC is working hard to identify those in our local population. The challenge there is that we already have a lot of the measures in place, and we continue to keep those measures in place because variant or not, COVID still spreads the same way. It's through droplet and contact precaution. The virus hasn't grown legs or wings. It's spread by people interacting with other people. So all the things that we're asking you to do, that Dr. Henry's asking you to do, that Dr. Kowski will ask you to do, those are the things that are going to prevent spreading that virus to other people. And so, I think it's all the much more important that we're following that advice, especially in light of variants, which may be more transmissible than previous versions that we've seen in our community. And so what I will also say is that most of the transmission we're seeing, 99% of it has been local community transmission within Whistler. Only 1% has been attributed to international travel. So I want to make that very clear that a lot of what you're already seeing are variants that are coming up from elsewhere in BC. And not these UK and South African variants, at least for the time being. And I hope to keep it that way. And the way we do that is continue to follow the advice that we've been outlining earlier and making sure if you do have COVID that you keep it to yourself.
Thanks, Dr. Harding. I want to give a final word to our CAO, Ginny Cullen, to sort of wrap up any thoughts she has for us. We have so many questions here. Thank you to everyone who has joined us. We will do our very best to compile answers for you and share them with you. And I'll turn it over to Ginny. Over to you.
Okay, thanks, Jack. And thanks for everyone for making time for this. One thing I just wanted to say is that we've been listening to feedback from the community. Input from you has been that, access to information from local experts in real time would be very helpful in reducing anxiety and uncertainty in our world right now. So that is what this is about. And we're open to getting feedback on how we do this in the future, how we improve on it, and what frequency we need to do that at. We won't have a limit in the future in terms of how many people join. I think someone said it's like the nerd who threw a party and everyone showed up. So we have council meetings every 2 weeks on Tuesday evenings. We would love for everyone to show up to those as well. But yeah, thanks for everyone for coming out, for being interested, and for all your questions. And we will follow up with this online as well.
Yeah.
Thank you.
Thanks, Ginny. I want to thank Dr. Kowski and Dr. Bailey for making this happen, for Dr. Harding for joining us and spending the evening with us, Lisa Mccullough, Jeff Buckheister, Patrick Weiler, our councils here, Barrett Fisher, Melissa Pache, Jordan Sturdy, Jackie Dickinson. It is a tremendous credit to you that on 24 hours you moved your life around to be here. Yes, thank you. You have served us so well, and we're grateful. So we'll compile these answers, we'll get them out to you, and please be kind, be calm, be safe. Have a great night.
Thanks, Jack.
Thanks so much.
Thanks, everybody.